In this video, we'll be talking about Infanrix Dtap Vial, which is a vaccine given to provide protection against diphtheria, tetanus, and pertussis in children between 6 weeks and 7 years old. It's important to note that vaccination is the best way to protect against these life-threatening diseases. The way vaccines work is by causing the body to produce its own protection in the form of antibodies. It's important to follow the recommended dosage and schedule for this vaccine to ensure the best protection for your child. Always consult with your healthcare provider to determine the best timing for administering the vaccine. Before receiving the Infanrix Dtap Vial, make sure to read the vaccine information statement provided by your healthcare professional and consult them for any questions you may have. This vaccine is administered through a muscle injection by a healthcare professional, usually in the upper arm or thigh. To ensure the best protection, the vaccine is usually given in a series of doses, so it's important to closely follow the vaccination schedule provided by your healthcare professional and attend all scheduled medical appointments. It may be helpful to mark a calendar as a reminder. Based on your age, vaccination history, and previous reaction to vaccines, your healthcare professional will determine the best combination of vaccines for you. Be sure to discuss the risks and benefits of vaccination with them. The Infanrix Dtap Vial may be given at the same time as other vaccines, such as hepatitis B, using a separate needle and injection site. The most common side effects of Infanrix Dtap Vial include mild fever, irritability, vomiting, loss of appetite, sleepiness, diarrhea, or pain/swelling/redness at the injection site. Acetaminophen can be used to reduce these effects. If any of these effects persist or worsen, it's important to inform your healthcare professional. In rare cases, some people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears after receiving a vaccine injection. If your child experiences any of these symptoms, it's important to notify your healthcare professional immediately. Sitting or lying down may help, as these symptoms typically do not last long. It's important to remember that this medication has been prescribed because the healthcare professional has determined that the benefit to your child outweighs the risk of side effects. Serious side effects are rare, but it's important to contact your healthcare professional immediately if your child experiences high fever, non-stop crying, seizure, listlessness/unresponsiveness, or muscle weakness/floppy muscles. While a very serious allergic reaction to this drug is rare, it's important to seek medical help immediately if your child experiences symptoms such as rash, severe dizziness, trouble breathing, or itching/swelling of the face/tongue/throat. This is not a complete list of possible side effects. If you notice other effects not listed above, it's important to contact your healthcare professional for advice. If you are in the US, you may report side effects to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967. In Canada, you may call the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018. Before your child receives the Infanrix Dtap vaccination, it's important to inform the healthcare professional about any allergies your child may have to vaccines or other ingredients. This vaccine may contain inactive ingredients that could cause allergic reactions, so it's crucial to discuss any potential concerns with your healthcare professional. Additionally, before using this vaccine, it's important to discuss your child's medical history with the healthcare professional, especially if your child has a history of Guillain-Barré syndrome, immune system disorders, illness/infection, seizures, or previous reactions to any vaccine. It's worth noting that this vaccine is not typically used for adults or children 7 years or older. As for pregnancy or breastfeeding, there is currently no information available. However, vaccines for this age group are available, and it's recommended to consult with your healthcare professional for more details. It's important to note that Infanrix Dtap Vial may interact with other medications, which could change how they work or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your healthcare professional. This includes prescription and non-prescription drugs, as well as herbal products. You should not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this vaccine are drugs that weaken the immune system, including cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids such as prednisone. It's also important to note that other recent or planned vaccinations, such as diphtheria/tetanus toxoids, may interact with Infanrix Dtap Vial. Be sure to discuss any concerns with your healthcare professional. Remember, it's important to follow your healthcare professional's advice and not make any changes to your medication without consulting them first. Infanrix Dtap Vial is a vaccine used to protect against diphtheria, tetanus, and pertussis in children. It is given in a series of doses to help build immunity to these diseases. The vaccine is typically administered to infants and young children in a series of 5 doses, with the first dose given at 2 months of age and the final dose given between 4 to 6 years of age. It is important to follow the recommended vaccination schedule to ensure maximum protection against these diseases. When it comes to vaccines for your child, there are many options to consider. Your child's healthcare provider will take into account their age, medical history, and any previous reactions to vaccines to determine the best choice. It's important to have a conversation with the healthcare provider about the potential risks and benefits of vaccination. Even if your child has had a previous infection with tetanus or diphtheria, it may not fully protect them from future infections. That's why the healthcare provider may still recommend the Infanrix Dtap Vial vaccine for your child. It's important to follow their guidance to keep your child protected. It's crucial to make sure your child receives the Infanrix Dtap Vial vaccination on schedule. Keep track of when the vaccination was last administered and update your child's medical records accordingly. When storing Infanrix Dtap Vial, it is important to keep it in the refrigerator, making sure not to freeze it. It is crucial to keep all medications away from children and pets to prevent any accidental ingestion. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. It is best to properly discard the product and it is expired or no longer needed. For more guidance on proper disposal, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.